All right, good morning. I'm going to get us underway, I hope. Good morning, good morning, good morning. I have to do a little bit of welcome and housekeeping. For those of you who were here yesterday, this will be a repeat, but since we're having another open session, I need to do it again. Welcome, everybody, to this workshop. I'm Jeffrey Kahn. I'm a professor of bioethics and public policy at Johns Hopkins University in Baltimore, and my privilege to chair this committee of the IOM. I'm going to read out a disclaimer in a moment, but I want to first do a quick round the room of my colleagues who are here in the room, and then we have three who are joining us by phone. So I just introduced myself. Maybe Alta, you can be next. Everybody needs to turn on their microphones when they talk.
Sorry, I'm muting that.
As you know.
Alta Schauer from the University of Wisconsin Law and Medical Schools.
I'm Keith Whaley from Princeton in history and the Woodrow Wilson School of Public and International Affairs.
I'm Marnie Falk. I'm a geneticist at the Children's Hospital of Philadelphia and University of Pennsylvania.
Lori Strongen, founder and executive director of Hope for Henry Foundation and author of Saving Henry, which is an account of my experience being the first patient to try PGD for HLA typing to save my son Henry's life.
I'm Alan DeCherney. I'm an OBGYN, and I'm at the NIH NICHD.
Jeff Botkin, Department of Pediatrics and Medical Ethics at the University of Utah.
I'm Vamsi Mutha. I'm a mitochondrial biologist at Mass General Hospital and at Harvard Medical School.
And we're joined on the phone by Jonathan Kimmelman. Jonathan, can you hear us and do a quick intro?
Yeah, hi, guten Morgen. Jonathan Kimmelman, Associate Professor of Biomedical Ethics, normally at McGill, based out here in Berlin this year.
And working on his German. Jim Childress.
Jim Childress, University of Virginia, where I teach bioethics-related areas.
Thanks. And Anna Mastroianni.
Anna Mastroianni, University of Washington School of Law.
Thank you. And we're joined by very, very able staff. Ann Claiborne to my left, Rebecca English to her
To your
right. Other left,
right.
To my right, and to her right. That's saying that doesn't seem right. and Morgan Statham and Mike Barrios. All right, let me read out the public disclaimer that we do when we begin open workshops. So please bear with me. As chair of the Institute of Medicine Committee on Ethical and Social Policy Considerations of Novel Techniques for the Prevention of Maternal Transmission of Mitochondrial DNA Diseases, I would like to welcome everyone to this open session of the committee's second meeting. This is an open, on-the-record information gathering session. As part of the IOM's process, the committee collects information and materials to consider and discuss as it makes its findings, conclusions, and recommendations. Therefore, I ask everyone to be mindful of the fact that the committee has made no conclusions about anything yet. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee, the IOM, or the National Academy of Sciences. In addition, committee members typically ask probing questions in these information gathering sessions that may not be indicative of their personal views and are not indicative of any committee consensus views. I talked yesterday about the IOM study task, process, and timeline. If there are questions about that, I would direct you to the staff who can explain that rather than my going through it. I'll just sort of recap very quickly that yesterday we had a very full day and a very interesting day. We went over various aspects of MRT and its implications, and we broke at the end of the day towards the end of session number 4, which is about science and medicine and the implications of the questions we are asking about science and medicine for our task. So in order to move us along, and maybe to say one housekeeping thing, we want to work hard, but not so hard as to not take any breaks. There wasn't a break in the agenda, so we're going to add one after we finish with the conclusion of session 4. So we'll add a 15-minute break at 9:30-ish. and we'll come back just sort of on schedule as the agenda shows. Okay? So with that, let me turn it over to Alan and Marnie, or Marnie. I don't know which of you is going to take the lead. Alan, to kick us off this morning.
Okay, so